Today on The Sensitivity Doctors, we have an inspiring and compassionate conversation with Jamie Copeland about how to navigate the ups and downs, the joys and excitements, as well as some of the challenges of parenting kids with ADHD. Jamie Copeland is a mom to 5 amazing kids and a military spouse, and the founder and CEO of Strategic You, a movement that shines a light on ADHD brilliance while offering strategies that fit into your busy life. Leveraging her expertise and training in psychology, combined with a decade of navigating ADHD alongside her son, her hub, Strategic You, is about more than just managing symptoms. It's about creating a life filled with understanding, growth, and joy for our children. Well, Jamie, I'm thrilled to have you here today, my fellow ADHD warrior who has been a big support to me in my ventures with reaching out to women with ADHD. And you have so many amazing offerings for families and parents who have ADHD kiddos. So I would love if you could help the audience understand what led you into this path and where did your journey of parenting a child with ADHD begin?
Yeah, absolutely. And thank you for having me. My journey began with my own son, who is 15 now and was diagnosed with ADHD when he was 5 years old. And it was kind of a whirlwind in that moment. You know, as a parent, you're just like, okay, so you've given me this diagnosis. However, what do I do with it?
Mm-hmm.
And there was so much help for him out there, but there was not a lot when it came to me parenting him and understanding what to do. So, at least from the doctor's standpoint, when he was getting that diagnosis. So, I just began doing my own research and really just diving in on what is out there for parents. And then I came to the point where he was in middle school and things just started to get even that much more complicated with schooling and, of course, hormones coming in and all of that plays. So, just through the years, I've really just done a whole lot of research. I had to do research when he became a teenager. We're also a military family, so we move a lot. And we know that change for ADHD is super hard. So
Mm-hmm.
I've really had to hone in with him and hone in on ADHD, what it's about, how to help him really cope and get through, all of this journey and just love him through it. So because of that, it led me into this, huge journey of like, okay, I don't want another parent to ever feel alone again. I don't
Mm-hmm.
want another person to ever feel like I don't know where to turn, and that's where my journey began is okay, let me be that voice for people.
And one of my favorite things about your message, and you and I met when I was on one of your wonderful symposiums that
Mhm.
where you were offering all of this, everything you're saying is your mission, you actively offer to parents and people who want the answers. And something that I really love about your approach is that you look at it as a strength based approach and
Mhm.
an empowered approach,
Mhm.
which I've noticed in the time I've been counseling, there's been a huge shift in the understanding about ADHD.
Mm.
And even this new idea that it is not necessarily a disorder, but that it's more of a deviation. It's more of a unique set of skills and talents, even, but that don't always fit some of the modern day molds. And
Mhm.
so I'm curious for you, what do you believe are the most important strategies for parents with children who have ADHD? And I know this will be unique person to person that you think really are based in that strength oriented approach?
Yeah. So when it comes to that question, actually, it can be multifaceted. It depends on where you're starting.
Of course.
Some people start, they learn that their child has ADHD when they're super young, like I did, and then others don't learn until they're in middle school. So
Mm.
as far as strategies go, the sooner you find out, the better. So I would point that out. Like if you see something or if you hear something from a teacher, don't be like me. And I'll tell you a little bit about that. I just was in denial. Like, no, he's just
Mm.
a boy. He's fine. There's nothing wrong with
But
him.
what do you mean with hears things that the teacher says and see things? Like, I don't have a lot of experience with ADHD. I have a very young child, so one would want to know, could you tell me a little bit more about what were those things that you were seeing and hearing and that were triggers or ideas?
Yeah, absolutely. Okay. So, when he was 5, he was in a Montessori school and he had a teacher who, she was a little bit on the stricter side,
Mm.
um, and she was just, saying like, hey, there's just certain quirks that he has that are, leading me to believe that he might possibly have something going on in his brain. Um, and she was trying to really beat around the bush. And I was just very like, no, you're just strict. He's fine. But she was pointing out things like, he throws tantrums when I ask him to do something. He um, is not wanting to really participate with the other kids. He wants to just go off and do his own thing. Um, he is having a very hard time focusing in on the lesson plans, right when he doesn't want to sit still and sit there and listen like all the other kids in the circle, and I'm just like, oh, well, he's just a boy. He's just got energy, high energy. Um, but, as he grew older, of course, and started to actually go to elementary school, there was just more and more of that. And I realized, okay, and I had taken him when he was 5 to get, and they said at that point, like, well, we could diagnose him with ADHD because he does fit in the parameters. However, he's still really young. And you might hear that often when it comes to doctors coming in and talking about it. It
Mm-hmm.
makes complete sense, right? Because they're still young, they're still developing. However, I would definitely implore you, anybody listening, if you hear that, then advocate for your kid, because the earlier intervention that you can have with them, the better off they will be when it comes to success and even their elementary schools and years and beyond. So
Mm.
those were things that I was hearing when it came to that. And going back to Amelia's question with strategies, on top of that, really speak with whoever your therapist is or your doctor, and really ask the questions, like all the questions that come to your mind. Ask all of them. Don't be afraid to. Don't just take what they're saying and just run with that, because really you can feel very lost in that moment of, well, how do I help them at home, and that's
Mm-hmm.
a very important piece to the puzzle, which is something that I really wanted to bring to the table here with Strategic You, which is what I do, is like, as parents, we really need to be able to know, like, okay, how can I come in and just really embrace them in this moment through this journey? See it as a strength, because there are so many strengths with ADHD. Also, understanding that it's just the way that the brain is developing, it's a different way of neural paths going through the brain um, than it is with those who have neurotypical brains. And it's completely okay, and just coming in and building them up. So, starting at a young age, that really, really revolves around routine. Routine is so, so important when it
Mm-hmm.
comes to ADHD, and them understanding it and staying consistent with that routine. Even if you are a family that moves often, like we were, find a way, for us, it was just maintaining that routine no matter where we were, and that
Mhm.
sometimes was clear across the world,
Mm-hmm.
and we'd have to
Mhm.
really start to like flip flop his days, um, but maintaining a routine is so very valuable and important. And then, once they get into that 8 years to 11 years, really kind of building in those tasks more to help them understand, okay, this is life, and life building tasks. And then building up their strengths at that point too, because as a parent, we all know what our child's strengths are. And we really get to look at them from a different perspective, a beautiful one, might I add, and just see like, okay, you are incredible at loving on your siblings, right? You just have a huge heart. That's one of my son's biggest features. He has a huge heart. And I would just really encourage that in him a lot more, especially when he would be out with his peers. Like, his empathy was just huge. And so it's like,
Mm-hmm.
okay, let's build that up more, and he's also very sports minded. He loves sports. So building in that, importance of a team sport effort and saying, hey, um, this is how we can play team, and really honing that in with him, uh, and then I have another son. I'll just throw this out there really quick too, that is not super great with teams, and that can happen too. And they are just better at singular sports, but that's okay. Just knowing that it's okay that they are where they are, building that strength into them, and then moving into the scheduling and goal setting is super important as well.
Yes. To offer a little bit of scientific support for what you're saying, a couple things I just want our listeners to really know. First of all, you mentioned the brain and the
Mm-hmm.
way it develops. And there is some research out there that shows that the ADHD brain does, in fact, develop at a somewhat slower rate, and it
Mm-hmm.
might take a little bit longer to reach full maturation. And so, for that reason, an expectation you might have of a 5-year-old who is neurotypical might look a little bit more like the expectation that you might have of a 4-year-old who may be a little bit more dysregulated. So
Mm-hmm.
this is not across the board, but this is just something to consider when you're stepping into your expectations for your child.
Mm-hmm.
And so to Jamie's point about meeting them where they're at, that can be really helpful in mitigating frustration. Another thing, I love that you mentioned sports. One
Mm-hmm.
of my biggest pet peeves is when someone uses a physical activity or sport as a carrot. Like, if you don't do your homework, you're not going to be able to play this sport. I just want to implore anyone listening, that is going to make your life much more difficult in your parenting journey,
Mm-hmm.
because the structure and the physical activity and the dopamine delivery that is provided by sports and the ego enhancing and the strength building is so crucial for the ADHD brain, which craves the healthy stimulation that the sport can offer. So finding a different carrot would be immensely helpful. Um, and, to your point about finding their strengths, rejection, dysphoria, and sensitivity is so huge in
Mm-hmm.
people with ADHD. So starting young, like you're saying, and intervening young. And intervention doesn't necessarily mean medication, everyone. That's maybe we'll unpack that a little. It can
Mm-hmm.
look different for every child, every family, and every situation. So maybe if you don't mind, actually, could I ask you, when you say early intervention,
Mm-hmm.
what do you mean specifically?
So personally, I did not medicate my son when he was that young. I was just
Mhm.
very concerned about, and of course, I'm a researcher.
Mhm.
So I was very concerned about the side effects of what it could have with him.
Mhm.
Um, so we really just focused in on the early intervention with the psychotherapy, as well as what we did at home with him and the importance, and going back to even what you were just talking about with the sports and how important they are. It is highly important because they don't get enough, with ADHD, they do not actually get enough lactic acid in their brains.
Mm.
And that is something that's extremely important to help the frontal cortex to develop and to work properly. So, and the other part of that, what you had said too about don't dangle it as a carrot, those with ADHD are super, they have a very hard time with change, like I had said before, right? So if you're saying to them last minute, like, well, if you don't do your dishes or you don't do your homework, then you can't go do this thing that you had planned in an hour, you're going to get a meltdown. You're going to get a
Mhm.
whole fit throwing. Like it's not going
Wow.
to be pretty. And then that just causes you more strife,
Mhm.
So um, I just want to throw that out there with that. And sorry, what was the rest of
Well,
that?
I mean, I like how you point that out, and I would encourage listeners to think of, rather than using, like, if you don't do your dishes, you don't get to go play the sport, or you don't get to go do the thing. What would then support the child to succeed at the activity in that moment? And
Mm,
that can take a lot of energy and mindfulness and ability to stay within your body as a parent, which
yes.
makes me think of something that I really want to ask you, because we have our neurodiverse listeners and our highly sensitives that come to this podcast. How can parents with their own neurodiversity, such as HSPs or ADHD themselves, cope with the needs they have while supporting children maybe in those tricky spots of, well, I don't want to do the dishes?
Yeah. Yeah, so they are tricky spots in that moment, and it does take a lot of energy as a parent. But I will say with HSP and ADHD, often you find that those are the parents that are actually perfect for a child with ADHD. I don't personally have ADHD myself. However, my husband, I believe, does. He hasn't been diagnosed officially. But there's definitely traits there. And sometimes he can really come in and just really take over those moments for me and, say calmly, okay, why don't we go at it this in this way? So that's one thing, is having a supportive partner that can just step in that moment, especially with HSP. Often you'll find that HSP is really good at being supportive and listening in those moments. But then if there's some really loud chaos happening in that moment, right, it was stimulating for them. So having somebody that can step in those moments when you need to take a step away is perfectly okay. And it's okay for you to take a step away. As a matter of fact, that's completely healthy. You're teaching your child in that moment that is okay. And you're actually creating those healthy boundaries, not only for you, but you're showing them how to create healthy boundaries as well. Like, hey, this is overstimulating for me. I need to just take a step back for a moment.
If you don't mind me saying, Jamie, you're so calm and so grounded, and I can only imagine that if you're having those moments of maybe raised loudness and overwhelm, your son must be so blessed to have you in his life, because I'm sure that's such an anchor for him in those times. And I really admire that about you. You're so calm and so,
Tell her how many children you actually have, because I was surprised.
I have 5 children.
Really?
I do.
Wow.
Yep,
But
2 boys and 3 girls.
that makes it even, I just have so much respect for you. I just admire you so much. I think that you must be really such a gift to your children.
Oh, thank you. That blesses my heart because every parent, honestly, and I think it's often that every parent will be like, am I doing a good enough job? And I actually would love to speak on that a little bit and just say to those parents out there that are feeling that way, you were made to be their parent. So that's the one thing I would like to say first off. And are any of us perfect? No, we all have our moments, but the fact that we're there day in and day out, actually loving on them and trying, and you're here listening to this podcast right now, shows that you are a wonderful parent. So I want to point that out first. And I think that when it comes to anybody that has a child with ADHD, or anybody who's listening that has a child with highly sensitive, I actually have, my youngest son is highly sensitive. He will cry at the drop of a hat. It's, and that's something I've really had to work through myself as a parent, because I had never dealt with that before. And I've had to learn, and I've had those moments of like, am I totally messing you up, kid?
We all do. We all have those moments. I've had them many times myself.
But I've had to learn, just, okay, let me listen. Let me hear you out in this moment. Let me let you get this all out, because these are really big emotions happening in this moment over what might be this tiny, tiny little thing, but it's just like, okay, you're feeling huge emotions about this. Let's talk about it. Let's take some breathers, and it's the same, as you grow older, and you need to learn to take those breathers. You need to learn to get all of the emotion out. Sometimes that means going to a closet, and that's perfectly okay, and just taking that second, taking that breather, and just saying, okay, I feel grounded. I feel like I can go step back out into this now and just give a really big hug to my child.
Something I love about the direction the conversation is going is that What we could be talking about are, do these checklists, do these tasks, take these supplements, cut out these foods. But instead, we're centering towards this idea of allowing the big feelings to come and to be present and to not necessarily have to fix the big feelings, but to understand that the big feelings have a time and a place. I once heard this metaphor about assisting dysregulated children through the emotion train. You and your child get on the train together, and you are going to go through the entire tunnel with them. And you're just the passenger and you're just the witness. And when you get to the other side, you'll still be there, rather than trying not to let them get on the train. Because the fact is that if we don't let our children have the big feelings and be there with them as that grounding source, as Dr. Jean was saying, you have such a beautiful presence for, they don't learn how to have these big feelings as they get older. And I think also about what you were saying about asking for a supportive partner to step in. I do want to just speak to our single parents or people who maybe have not even single, maybe they have a partner who works a lot. They don't have that extra support. This might sound a little unconventional, but to your point about modeling, especially if you are a neurodiverse parent, it's okay to do the coping skills together. It's right. And to say, let's sit down together. Maybe we can meditate together. Maybe we can walk together. Maybe we can do art together. Maybe we can cry together. It's okay to show that through the whole structure of your family.
Yes, and I will speak on that just a little bit. Like I said, we are military, so my husband was gone often, So another thing I would implore with you, because this is something that as military spouses we did often, was we helped each other in those moments. We really just built a village around us. And I know that concept of village parenting, I think it's coming back in ways, but it's been kind of lost. And it's something that's just super important because us moms need each other, and even dads, like, iron sharpens iron. Men need men too, and there are a lot of single fathers out there too that are incredible dads, but they need a moment too, and it's just finding that village around you that can really support you in those moments, and they can step in and just say, I got this for you, friend. Let me help you here. I can see you're getting overwhelmed. And there is some massive power in that. It really, it just helps you to take a breath in that moment and just say, so I would definitely implore people, like, find your village,
Right. And if we were to then angle towards interventions and things that do help parents with children, I had mentioned to you before, one of my favorite talks on parenting ADHD was by the prestigious Russell Barkley. I love him and all his work. He
He
is
does it.
incredible,
Yes.
and really a pioneer in the field of ADHD. He had this talk where he was talking about interventions, and that when we look at things like behavior charts and different goal setting and all of these things that are meant to help boost ADHD kids and teach them new skills, he had eradicated the idea that they're meant to change the brain. However, I think there's an idea that with behavior modification, you're changing the ADHD brain, which is quite possibly nearly impossible because we're dealing with a beautiful neurodiverse brain that functions the way it's meant to function for a reason. There are ways to optimize the ADHD brain,
Yeah.
and that's what these interventions are for. So instead, he calls them props. And the way that he metaphorically put this was, if you had someone who's in a wheelchair and they have a ramp that's supposed to help them get to the next floor, you wouldn't expect the person in the wheelchair to use the ramp enough times where suddenly they're no longer going to need the ramp. It doesn't make sense. Instead, it's a prop you put in place because it helps that person get to where they need to get. So if we were to change the way we look at behavior modification with our kids as props, instead of something that's meant to change our kids. How do you think that could relieve pressure on parents and maybe increase hope?
So, when it comes to the behavioral charts, sometimes the children can see that as being, a negative. So, I
Mm-hmm.
like to say instead of looking at it as a behavioral chart, let's look at it as the positivity chart, like the strength chart, right? And
Mm-hmm.
you showed your strength here today, basically, and just really kind of going alongside it in that way instead of, oh, your behavior was bad today, so we don't get a star here.
Mm-hmm.
Or, we don't, because that ends up, and we know very well that children with ADHD often hear, what is it, like 10,000 negative words towards them by the time that
Mm-hmm.
they're like
12.
12. Is that
12.
what?
Mm-hmm.
Wow.
Mm-hmm.
Yeah. So it's really just honing in on staying away from the word behavior, staying away from the word, any words that are negative, right? And in
Mm-hmm.
this culture, behavior is seen as a negative thing. And what I am really trying to do with Strategic U is taking out the word behavior from ADHD at all. Because as we have just been discussing, ADHD is not a behavioral disorder, which a lot of people are really taught that it is. It's not.
Mm-hmm.
It's a different wiring of the brain, it's a different mindset. And those people, anyone with neurodivergence, are actually needing to be seen as extremely like valuable in this world. And they are,
Mm-hmm.
because you think about
Mm-hmm.
it, they think outside the box, they think differently, and they can come up with solutions that those with a neurotypical brain absolutely cannot. And being able to work together with them is huge. So, just talking about Dr. Barkley, who is incredible and so appreciative in this world of ADHD, and what he had said, I love that he says props and uses it as props, and I'll stay away from the behavioral mindset part. And then he also talks a lot about the ADHD medication and what that can do for the brain ongoing. And like you said, we don't know. There's not a whole lot of long-term studies with that. I'd love to see more. But he also really talked a lot around just bringing in that psychotherapy point and using that to your advantage to help your child to grow into a human being that is
Mm-hmm.
like extremely successful. And let's face it, that can go with anybody in this world.
I'm curious about the medication. I
Mhm.
think you mentioned that in the beginning you weren't pro medication, and
Mhm.
I'm just thinking of this as a perspective from a mom's perspective, right? My little girl is 6, and she's at that stage now where small things that kids say are becoming sensitivities to her. Like she's asking, she has a little mark here,
Mm.
beautiful, but now it's starting to become like, why do I have it? What can we do to take it away? Like these small comments, right?
Mhm.
So I'm wondering, how do you have that conversation with your child? Do you explain to them that they need to be on this medication and why? Like, does that come up? And I'm just curious as to how you navigate that.
So Gavin started to be on medication when he turned 13. We had tried it when he was younger. We didn't really like the side effects that he was experiencing. And at that point, yes, he was very embarrassed. He thought, oh, why should I have to be on medicine? He didn't want to tell the school he had ADHD. Um,
Mm-hmm.
a lot, of just big feelings were coming out in him when it comes to this, because he really looked at it as something was wrong with him, you know? And I got to just really look at him and just say, there's nothing wrong with you. Sometimes we just all have a hard time with focusing. And this medicine is just here to help us with that. And then I asked him questions, like, when you're in school, do you feel like, you really do have a hard time focusing? Do you feel like you are able to really interact with the other students as well as another student that would be a peer of yours? I asked him just a series of questions like that he would come back with, well, no, not really. I do have a hard time focusing. I don't it's not easy for me to sit there and listen to a teacher because sometimes I'm really bored with it, you know. You know, and it would just turn into this conversation. And I said, well, this medicine is actually here to help you, you know, and let's explore this and let's see where it goes, you know. And really the ballpark is there in your wheelhouse because I don't know how you feel when you're on these medicines. Only you do. I don't know how they affect you. Only you do. So let's, you know, keep that open conversation going and just figure out what's going to end up benefiting you the best and just keep playing around with this, you know, which as a parent is really hard. And so my heart does go out to every parent that has to deal with, you know, having those conversations, those hard conversations that has to, but we, at the same time, we get to, right? We get to take our emotions out of it and we get to be there for them and we get to really just love on them in a powerful way here, you know? And so having those open conversations with them, absolutely. And then from there, we were able to really hone in on, okay, here's the medicine, here's the right dosage. This is really working for you. Great.
I love that because what you just explained is like a 13-year-old version of going through the emotion train tunnel with a 4-year-old. Like you said, take your emotions out. I do want to just witness that the emotions, while present,
Yes.
and very, very reasonable to have emotions about whether or not your child needs to be medicated or you choose to medicate. But I'm hearing you say you can come back to those emotions, but for that moment, you're there holistically for theirs.
Right. The thing is that in that moment, I realized this isn't about me. You know, this is not about me. This is about him and making sure that he's set up where he needs to be and that he feels complete confidence in who he is and how he is able to really focus in this world.
I love
So,
that because I feel like so many clients, parents I speak with, they get very focused on whether they are making the right choice. And I don't know if they're including the child in the conversation enough. So I love your example because it is so individualized. And I loved your questions because often I'll have folks ask, is it the best idea? Should I medicate? Should I not? And the direction we're not going to go today is should you medicate? Should you not, as far as the neurochemistry of the brain, but more the social aspect and the behavioral aspect of whether to medicate or not. Because as you were saying, if there are interferences with bonding with your peers, if there are interferences with taking what you can to succeed from whatever avenue you want to go academically, if there's a block, that long-term impact can be more of a negative impact than some of the side effects, which, to speak to what you were saying about side effects, things like reduced appetite, irritability, issues with sleep, these can be side effects that if they are severe, talking to your doctor, adjusting your medication is very helpful. But there's one other little thing that it kind of makes me think of Tom Hartman's book where he's saying A Hunter in a Farmer's World.
oh, yes.
When people ask, why do we even have to medicate this? If you're saying it's not a disorder, why does it have to be medicated? And here's my thought on this. In this modern world, in this world we have where we are sitting in studios expected to sit straight and still in front of a screen with lights, we're indoors, all of these things are somewhat unnatural to the human body and brain.
Yeah.
So there's a reason why we supplement things like vitamin D, why we supplement things like omegas, which truly we should naturally just be able to acquire. So if we think about this beautiful ADHD brain, I joke with some of my ADHD adults, if you could just live on a campground or in a farm or somewhere in the sunshine where you could move all day and let your brain do its beautiful thing, the medication would most likely be obsolete. But we're
Yeah.
expecting our kids to sit and learn and attain information in these highly structured classroom settings. And so sometimes supplementation to help your brain do its best thing is what's needed.
Yeah. Yeah. And I think that it's was one of the hardest decisions for me to make with my son, because, typically I really do go more towards the natural side of things and just giving my children as much benefit in the natural that they can get out of this world. And supplementation is definitely one thing. We do a lot of vitamins. And there's a lot of research out there, as a matter of fact, with ADHD brain and what vitamins they are missing. And I'm not going to go into that today, but I do implore people to look at that. However, with the medication side of things, there is a lot to do with that. And Dr. Broccoli, he does talk about this, with the medicines. There's a lot of studies in it, and they have had it for quite a long time now, to where they have really honed in on the medicines that really do help the brain to be able to fire in the ways that it's supposed to.
Mm-hmm.
And, there's something to be said about that. So that would be, I am not here to tell a parent to medicate or not medicate. However, I feel as a parent, what is absolutely best for your child, and to go with your gut, have that dream team, and I say a dream team, I mean the school, the doctors, the therapists, all together, where you really are feeling confident and comfortable with them.
I love that you're talking about advocating, because even if you don't have a partner, even if you feel like the village is not there yet, the more you show up and advocate, the more you're going to get at least that dream team that you're talking about.
Yeah. So I think it's Dr. Noreen Russell wrote a really great book on the dream team and the importance of having one, and asking the questions that I cannot remember the exact name of the book right now off the top of my head, but it was a really wonderful book to ask those questions. So that's where you really get the doctor to get your, like, oh, okay, this parent actually really cares, right? This parent actually really wants to know. And you're also boosting their ego often, of like, hey, I'm trusting you here, but with advocating for your child, not only are you getting the attention of those that are caring for them, but your child's also seeing that in that moment. And they're like, okay, I am safe. I can be confident here. I can be comfortable here. And that really does make a massive difference for those with ADHD, because sometimes they don't feel safe in their environments, and as we were just talking about HSP earlier, ADHD can come with various other things that can go along with it, anxiety, HSP, overcompulsive disorder, different things that can happen within ADHD as well that goes alongside it. And being able to really bring about an environment for them where they feel safe and confident. Whoa. I mean, the amount of what that will bring for them as they grow, it's just it's huge. So, and that's something I had to realize the hard way, and so me being able to bring that to parents now, it's just huge for me, to be able to say, hey, yep, it's okay. Up until now, you didn't understand this, because neither did I. But guess what? We still get to work on that. And then we get to help our kiddos to really just thrive in this world.
To your point, it is actually not abnormal to see folks who are neurodiverse in the way of ADHD and then also be highly sensitive, when you consider that both are dopamine sensitive brains. So it is quite common. I see that a lot in my practice, where someone will have a difficulty with that comorbidity. Am I highly sensitive? Do I have ADHD? There's a lot of overlap with trauma. There's a lot of overlap with anxiety, obsessive thinking, especially in girls. A lot of the ADHD symptoms in young girls, because you were saying you have a boy, but there's a totally different factor with young girls who a lot of their hyperactivity is going to be internal, and a lot of their kind of agitation or irritability or racing is going to happen in the thinking. And so that can sometimes look like anxiety or obsessive compulsive personalities. So That would be a whole different topic. There are so many
Yeah.
different areas to go with this. But when
Yeah.
And this
you
has been such an interesting
I
conversation so far. Yeah.
know. When you
Yeah.
consider, though, Jamie, as Dr. Jean was saying, you are such a positive beacon of light and hope. What is something that you are most hopeful about when it comes to parenting children with ADHD and what we as a society are doing in this area going forward?
So when it comes to parenting, I'm most
Mhm.
hopeful for parents to realize like your child's okay. There's nothing wrong with them.
They're
They just,
exceptional.
Hmm.
oh man, are they? And they know that. They can see that. They can see that their
Hmm.
child is extremely brilliant, you know,
Hmm.
and just realizing like that is a strength. Pull out their strengths. Continue
Hmm.
to just really look at that and pull out their strengths. Can you get frustrated sometimes? Absolutely. We are human, right? But
Hmm.
just take a moment in that time to take a breather and say, okay, how can I turn this around to their strengths, to really just point that out in them right now, and then as society goes, stop saying it's a behavioral disorder, because that is something
I
where
love that.
we are once again really looking at this in a negative light. It is not a negative thing to have ADHD,
Hmm.
and it started out years ago, and I think the first thing that they called it was early brain,
Hyperactivity of the brain. I don't know. Yeah, I have to look that
yeah,
up.
early brain damage or something like that. Yeah. And it's not, you know, we were all made and wired to be who we are supposed to be, and we know that it's not early brain damage.
I've
It's
got it. Hyperkinetic impulse disorder.
Oh,
okay.
wow. That's intense.
But they bring a certain aspect to them, that helps them to really be our promoters, that helps them to think outside the box, to problem solve, um, and just seeing that beauty in them, right? And in this world, for teachers and administrators, it's not their fault. They're taught and they have so much care, in them. They're just taught that it's a behavioral disorder, so they've always looked at it this way. Look at the executive functioning pieces of this.
Hmm.
Start really focusing in that area and then building in their strengths. And you will see a massive difference in this world when it comes to ADHD, and then with parents, communicate with the therapist. That is a huge piece right there, is really communicate with the therapist. Of course, there's HIPAA, but they can tell you what strategies to do at home that they're working on.
Hmm.
Mhm.
Absolutely. So, anyone who's listening who would like to learn a little bit more about your offerings, because I know you also had a gift for our listeners,
Yay.
Mhm.
where can they find that? What is that? And where can they find more about you and your work?
Yeah, absolutely. So, Strategic U is our company. You can find that at strategicucommunity.com. And on there, you'll be able to download our Strengths Finder assessment and be able to find your child's strength or your strengths, even as an adult with ADHD. And yeah, I'm Jamie Copeland and the founder and CEO. And we also have quite a few affiliates that we work with as well that are passionate about ADHD. Dr. Millie Kelly being one of them. So.
That's so wonderful. And we will put all the links in the episode description in case you're driving and you can come back to it and just click on through.
Absolutely. Well, Jamie, thank you so much for being here. I cannot wait to sit down with you soon for my book event for the ADHD empowerment book for women. We're going to have a lot of fun. So I will see you soon in the real world. But thank you so much for your time, for all the work you're doing, helping to support parents and children. And just hoping that everyone here walks away with some hope and some ideas and the desire to learn more. Thank
Yeah.
you.